The ancient Egyptians had an incredibly sophisticated way of practicing medicine that involves surgeries, casts, and even magic. Let's take a trip way back in time today and learn about some of the earliest known medical practices as we cover the top 10 scary surgeries Egyptians actually performed. Starting off in our number 10 spot, we have dental surgery. So back in the ancient Egyptian world, it's not like you could just take a quick trip to the dentist to get your teeth checked and cleaned yearly, and the diet of the average ancient Egyptian was most definitely not exactly conducive to having an impeccable set of pearly whites. That's mostly due to the fact that the tools used to grind food would often leave traces of sand and stone behind, which, with their naturally abrasive qualities, would in turn cause tooth loss or troubles at an early age. Through documents found, there have been a few different dental treatments from that time that have been discovered, like topical treatments and such, but one case was able to give us a glimpse into what is believed to be the treatment of an abscess. Even more interesting is a mummy that was found from the 4th dynasty. This mummy, in his first molar, had a bunch of surgically produced holes that they believe were used to drain an abscess, which clearly gives us some very tangible evidence that dental surgeries were in fact happening all those years ago. Before we head into the rest of this list, we also have to remember that all of this was done without anesthetics. They may have had some herbs and that sort of thing to help ease the pain or something like that, but nothing compares to the tools we have now. In our number 9 spot today, we have stitches. Just in general, while surgery did exist during ancient Egyptian times, invasive surgery wasn't quite as common because, well, no painkillers, no antibiotics. The list goes on. One thing that's less invasive but still extremely important that was seen quite a bit during these times, however, was the use of stitches. Ancient Egyptians found different and effective ways to make their own sutures in order to close large wounds. They did so by using plant fibers, hair, tendons, and wool threads, as evidenced in different mummified remains that have been discovered. In the oldest known surgical text, which is now referred to as the Edwin Smith Papyrus that came from ancient Egypt, there are 48 different cases of sutures being described. One example from the text of treating a laceration reads, quote, "If thou findest that wound open and its stitching loose, thou should draw together for him the gash with 2 strips of linen." In our number 8 spot today, we have the transition. So no one is quite sure exactly where the origins of this practice come from, but it is thought by some that it may lie with the ancient Egyptians, as it is some of the first examples we have seen. The Egyptians did sometimes practice male circumcision, but it was done for the sake of cleanliness. In our modern world, much of the time, those who choose to undergo this procedure do so at infancy. Well, I guess they don't choose and rather their parents do, which is of course quite a polarizing subject, but regardless, that is the most common practice nowadays, but it wasn't the case back in ancient Egypt. During those times, it was actually performed during a person's pre-adolescent phase, which is what has led experts to believe that it might have been done as part of a ritual to commemorate a transition from boyhood to manhood. It wasn't something that was a sign of social status or class, as based on the preserved bodies that have survived up until now from ancient times, there doesn't seem to be any sort of trend connecting those who went through the surgery and those who didn't. In our number 7 spot today, we have hernia. When we think of modern medical problems and their surgical fixes, it can be hard to imagine how on earth people in ancient times dealt with similar problems, and I gotta say, hernias are one of them. Like, imagine the first person to get a hernia. They were probably so confused. But as it turns out, in ancient Egyptian times, they were already doing surgery to help repair them. Egyptian pharaohs had a group of physicians who worked hard to preserve the health of their ruler, and these physicians, of course, as anyone would hope, needed to have a vast knowledge of the body and how to treat different ailments. In the Egyptian tomb of Ankh-Mahor at Saqqara, which dates back to around 2500 BC, there is an illustrated sculpture of a surgeon performing what is believed to be a circumcision, as well as possibly the reduction of an inguinal hernia. It doesn't stop there though. The mummy of Pharaoh Merneptah, as well as the mummified body of Ramesses V, both showed signs of surgery, likely in an attempt to fix a hernia. Honestly, I never thought that one day I'd be talking about ancient hernias, but the more you know, I guess. In our number 6 spot today, we have magic medicine. Okay, so I'll admit, this one is not a surgery that was performed, but it's really an important part of all ancient Egyptian medical treatments, so of course we have to talk about it. As evidenced by everything on this list, the ancient Egyptians were clearly medically sophisticated, and they used a wide variety of very legitimate treatments, but these were not their primary method of treatment. No, the main treatment was still magic. It was believed that all diseases were caused caused by the supernatural or by deities, so of course the supernatural was needed to combat it. Like, as an example, let's take whooping cough. So to treat it, they have the medical side, which would have been grounded roasted mouse mixed into milk, which, for a second, let's pause for how horrible that must have been. But the more important part of the treatment would be the lullaby that was said after to help drive off whatever evil spirit was plaguing you. So a little bit of medicine, or mouse I guess, and a little ditty and you're on your way. Not a terrible trip to the doctor. In our number 5 spot today we have a nose job. Plastic surgery is more widespread now than it ever has been before, but it all got its start long before now in the days of the ancient Egyptians, although of course not in the same way we think of it today. In the Edwin Smith Papyrus, along with a documentation of trauma surgeries, bone fracture fixes, and all of that, the text also showed examples of fixes for nasal injuries. The treatment involved manipulating the nose into the desired position before using wooden splints, lint, swabs, and linen plugs in order to hold it in place. I mean, it's like an ancient nose job. That's crazy. It's truly wild to think about how much the lives of these people helped shape our world today. While so much of their civilization remains a complete mystery to us, what we do know now has helped inform us so much. In our number 4 spot today we have prosthetics. The ancient Egyptians were a culture of firsts, and some of their achievements we still have no idea how they were able to accomplish, and some of the others just paved the way for the success of us modern humans, and this is just one example of that. It's very likely that some of the first ever prosthetics were used in ancient Egypt. A female mummy who was discovered near Luxor had her death dated somewhere between 950 and 710 BC, and she was also found to have a prosthetic toe made from wood and leather. While this is of course a wonderful cosmetic replacement, and it's no secret that the ancient Egyptians clearly valued aesthetics, it seems as though the prosthetic toe was completely functional and was actually used to help the woman walk. The toe had significant signs of wear, which then inspired experts to start a study. They took participants and tested their gait both with and without the use of a replicated toe. In ancient Egypt, the common footwear was sandals, and walking in them would have been made significantly more difficult without a big toe. It's clear that this prosthetic was very helpful and important to those similar to the Luxor mummy. In our number 3 spot today we have breaks. So of course those living in ancient Egypt broke bones or had dislocations sometimes. I mean, those things can be kind of fragile, and they were often doing grueling work, but it's not like they could just head over to Emerge and get an x-ray and a cast and some crutches. So how did they treat broken bones or dislocation? Well, we can look at one example from the Edwin Smith Papyrus where there was a patient with 2 dislocated clavicles. The treatment is described as follows: If thou examinest a man having a dislocation in his 2 collarbones, shouldst thou find his shoulders turned over and the heads of his 2 collarbones turned towards his face. Thou shouldst cause them to fall back so that they rest in their places. Thou shouldst bind it with stiff rolls of linen. Thou shouldst treat it afterward with grease and honey every day until he recovers. Basically, there were some people in ancient Egypt who were really good at setting bones, and to keep them in place once set, they would use wooden splints and linens. On mummies, we have found quite a bit of evidence of fractured bones healing in good positions, but there also have of course been many cases of the opposite. At the end of the day, most fractures heal well in primates and humans without access to orthopedic treatment, so even if the bones weren't set perfectly, they will still heal. It just depends on the break and how these bones healed, what effect on the body it will have afterwards. In our number 2 spot today we have the mummification process. Many people, especially those with a limited knowledge of ancient Egypt, when they think about it, their minds would go to pyramids and mummies. The pyramids are one of the greatest mysteries of our past, and the mummies we have been able to find and discover are incredible because they've given us the smallest insight into the incredible civilization, but because the ancient Egyptians were so sophisticated in the mummification process, they also got really good at another major creepy kind of surgery. That is the post-mortem dissection. In order to mummify the body, they needed to remove any moisture from it. This process included the removal of brain tissue, which was done through quite a gruesome hook tool. This was not a medical practice, however, and was more of a spiritual one, so it wasn't performed by doctors. This is exactly why, although they were getting extra up close and personal with a person's internal organs during this process, the medical information they gathered during it was never used for any kind of medical treatment or medical advancement. In our number 1 spot today we have cancer treatment. Cancer is something that is obviously very prevalent in our modern society, and because of the rising rates, it makes us ask ourselves, did cancer exist in ancient times? While they didn't call it that, it definitely did. period. Some of the earliest evidence of cancer is found in ancient manuscripts, mummies, and fossilized bone tumors that have been found in ancient Egypt. There are a ton of examples and different forms of cancer that have been found, but perhaps the oldest comes from 3000 BC, and it was found in the Edwin Smith papyrus that we talked about many times before. In this text, it describes 8 cases of tumors or ulcers of the breast and how they treated them. Back then, these tumors were removed by cauterization using a tool called a fire drill. Other than this though, the text says in reference to the illness that there is no treatment. Alright guys, that has been our list for today. Thanks so much for checking it out. I've been your host today, Olivia Kozlowski, and I'll see you next time. Bye!